Hi, welcome back everybody. I'm Dr. Martin Gorman, practicing in Encino, California, and we're in the final segment of the 4 B's involved in integrative dental medicine. The 4th B is the body, and we're going to touch on systemic inflammation, nutrition, physical activity, toxins, stress, and gastric reflux. We'll start first with systemic inflammation, and that's the chief cause of most chronic health issues is inflammation. And typically, where there's inflammation, there's fire. It's the all take off on the old phrase, where there's smoke, there's fire. Well, if you have inflammation, there's something really going on that's wrong. And in dentistry, we find it very early in the mouth. We see it when women are pregnant with pregnancy gingivitis, which is an inflammation of the gum tissue. We also see the first signs of diabetes in the mouth. Part of the thing is with systemic inflammation, it's really caused by a lot by bacteria and tremendously by having inflammatory diets, which we're going to get into in the nutrition section. But there's certain things we can do. We've discussed it a little bit already with bacteria in the mouth, periodontal therapy, saliva testing, even testing for diabetes is also something that a lot of dental offices are doing and starting to do now. Like I said, literally every chronic disease is a disease of inflammation. Number 2 is nutrition. And really quickly, all of us should be on an anti-inflammatory diet. And here's a little chart that we give our patients now. And it has anti-inflammatory foods, and it's like grass, pasture-fed meat, poultry, sweet potatoes, nuts, wild-caught fish, bone broth and vegetable broth, ginger, green tea, vegetables and fruits, organic omega-3 eggs, etc. And the pro-inflammatory diets is the ones we all love, is refined grains and whole grains and flour, deep fried foods, processed foods, fast foods, and all kinds of salad dressings and most oils are really bad for you. Now, just as a quick example on nutrition is, we were out to dinner a few weeks ago with a friend of mine who's a pediatric gastroenterologist, which means they scope the stomach and gut of young children that have issues. And they did a scoping on these 2 young boys that were 7 and 9 years old, and they both had tremendously inflamed bowels and colons, and it was really, they were in pain and very extremely uncomfortable. And all they did, they put them on an anti-inflammatory diet, and when they came back 30 days later for a check, both boys were 98% improved. Literally all their inflammation was gone just by going on an anti-inflammatory diet and staying away from all the foods we all eat. Anti-inflammatory diet is where the action is. 98% reduction in inflammation in these two young kids due to just changing their diets. So it's really, really critical. Diet is critically important to overall health and well-being. As I stated previously, vast majority of chronic diseases are all inflammatory in nature. Inflammation is the body's response to something being wrong. Next is on the list is physical activity. Now, physical activity, you go to the gym, you work out, which is great if you do that, but something really simple to do is just fast walking for 30 minutes a day, 6 times a week, will give you as much power and result as going to the gym doing cardio. Next, we're going to talk about toxins. We all know when we would think from toxins, smoking, tobacco would be the number 1 source of toxins. But in reality, the number 1 source of toxins, again, is food. It's amazing, but it's food. Even in fish, there's mercury and lead in fish. Not healthy. Other things is the pollution. Here in Los Angeles especially, the air isn't as clean as it should be. We have pollutions, we have pesticides, we have herbicides, gasoline fumes when we're pumping gas, and like I said earlier, the heavy days of smog sometimes here in Southern California and other parts of the country. Those are all toxins. Wearing masks may help to a degree, but getting better filters in your home for your air conditioning heating units is a good place to start. But you have to realize, if you don't change them when you're supposed to, they're not working. But toxins are huge, but the number 1 toxin in our body is the food we eat, which goes back to nutrition and being on an anti-inflammatory diet. I hate to make a pitch, but whole foods is where we should be. Okay, next, we're going to assess stress. And you can put anxiety in there. And we almost don't even have to talk about it, because everyone knows everyone's life is stressful. We're all on our cell phones all the time. We're always getting text messages. We can't live without being connected. We never have time to just relax and take a deep breath. Going out for the walks, for exercise is really good to get you away. Shutting off all your electronic data, all your electronic equipment at home. You know, when you go to sleep, it's supposed to be cool, dark, and quiet is really for the best way to sleep. You have to remember where we came from. In the old days, there was no electricity. We went to sleep when it got dark. We woke up when the sun came out. Now we're altering everything with, you know, the hour changes, daylight savings time changes, and we have all this light in our home, and there was never any light. We have all these distractions, all the electronics, all the televisions. So all that is giving us stress in our body. We may not feel it so much, but it's there. And lastly, we're going to talk about gastric reflux. What is gastric reflux? It's when acid from your stomach just gets sucked up into your mouth, and you get acidic tasting in your mouth. And typically, it's a sign of a sleep issue, like sleep apnea, where the gastric juices come up. So what we want to do is, obviously, if you have that problem, you should check and get a sleep study and see if you have sleep apnea, and get examined and have a qualified health professional check you out. And the other thing could be is that you're drinking too many and having too many acidic foods, too many sodas, too much, you know, citric, too much orange, grapefruit, lemons. All that goes into your stomach, and your stomach's already acidic. So if you want to really put something in your stomach, you want to calm it down a little bit, lower the pH a tiny bit, and putting sodas and a ton of different citric fruits in can be a negative. But gastric reflux basically is a sign of sleep apnea. So that finishes off our discussion of Integrative Dental Medicine, the 4 Bs: bite, bacteria, breathing, and the body. Hope all these segments were informative, and I hope that you look at yourself and realize you may or may not have some of these issues. And if you do have some of these issues, I hope you go out and seek a healthcare provider that can help you and improve your quality of life. Thank you for listening, and have a great day.